Kat. Good afternoon, everyone. Welcome to the webinar. And again, thank you for joining us today. As the title suggests, this webinar is targeted toward families and individuals to share information and resources around COVID-19 and staying healthy. Again, my name is Lisa Nothouse, and I am the lead for supporting families with the Division of Developmental Disabilities. The information that we're going to share with you today is intended to help decrease some of the overwhelming feelings that you might be experiencing around COVID-19, help you make informed choices about your health and well-being, and provide you with beneficial tools and resources that can be explored further to help guide you in making your decisions. When we first started talking about doing this webinar, I could immediately relate to the relevance of the topic because I also have a daughter with a developmental disability, and my family and I share those feelings of being absolutely overwhelmed with all that's going on right now with COVID-19. And like so many other families I know, I too have experienced, and I continue to experience, feeling overwhelmed at times, and it can really feel like information overload. But what is different for me is that as a parent, I not only have to take in all the information and apply it to myself, but I also have to stop and consider everything from my daughter's perspective. And I have to think about what is going to be best for her and her health. So I not only have to process the basic information, but I also have to consider all the extra details related to her unique disability and health factors. And I recently participated in a webinar that focused on family engagement during the pandemic. And on that call, we discussed how stressed some families really are right now, which was actually what was keeping them from engaging, making choices, or even taking action at all. So if you're a parent, a family member, or an individual with a developmental disability, you are likely to have some of the same similar layers of added stress on your plate right now too. So for example, you might be dealing with returning to in-person school or another program, and you're concerned with health and safety issues like wearing or not wearing a mask and how that's going to affect your health. You might be trying to adjust to a new norm, which has greatly affected caregiving supports in your home, accessing your community safely, getting back to a routine that allows for work, play, and recreation, and many other individual details that probably some folks haven't even thought about yet. All of these factors and even more are layered on top of the known negative effects of COVID, including the severe illness or loss that we may have experienced. I don't know about the rest of you, but when I start feeling overwhelmed, I sometimes have a hard time taking in all the information and deciphering what I need to focus on the most. Therefore, I unfortunately probably miss a lot of the important facts. And now with COVID, I also have to weed through which information is most beneficial for me and my daughter. We know that families and individuals might sometimes need some extra support. And we also know that it's very important for them to have access to current, relevant, and easy to follow information in order to help them make the best informed decisions they can. So in the next few minutes, Mary and Leslie are both going to share some very useful information and key resources that will help you make informed decisions regarding COVID-19 and your health. So Mary, if you're ready, I'm going to turn the presentation over to you.
Good afternoon, everyone. Thank you so much for joining us today. Like Lisa, and probably many of you on this call, I am a mom. And I have a daughter with unique abilities and disabilities and multiple special health care needs. In addition to that, I am the director of Missouri Family to Family, and we receive phone calls from the entire state of Missouri with individuals who are requesting information, needing referrals, needing some assistance, and sometimes some navigation and hand-holding around this very important and very stressful decision regarding the COVID-19. So I'm very happy to join with this panel to provide some additional information about how to make the decision, how to become informed, and how to search to find the best answer for you and your family. Like all of us on this call, it's not just about our family, it's also about the families that we have contact with or it might be about our caregivers. One of my daughter's community support workers who comes and spends time with her has diabetes. So in making these decisions, we have to consider other lives that might be impacted by the lives that we live. At the Resource Center, we support individuals and families, as mentioned before, and it has been a privilege to work with this team on some of the information that they want to share with you. And I'm going to turn this over to Kat right now, and she's going to show you a video that has been prepared that will help you as you continue your journey on figuring out your response to the COVID-19 epidemic that we have in our nation.
Can you give me one moment, please?
Who is it that they'll listen to? Who is it that will make the biggest impact on them? But we also need to know, how are people getting access to the services they need? Do they have the transportation that they need? Do they have masks to wear? Do they know where to go get the vaccine if that's what they need? So we use those three buckets of support throughout our entire conversation about staying safe and getting back to basics. So now let's think about getting back to basics. What does that really mean? Well, we use the trajectory to think about that. So we know our vision for getting back to what we want is going back to work, hugging our friends. And if I sit down with somebody and say, what are the things that might prevent you from getting back to doing those things? The first thing is are you washing your hands? If you don't wash your hands, that might prevent us from going back to being able to get back to the basics of life. If we don't cover our cough or our sneeze, we don't stay home when we're feeling sick, we don't wear a mask if it's needed, and if we don't get vaccinated, these are all things that might prevent us from the vision for what we want and take us towards getting sick, staying sick, and getting others sick. But we can also have that conversation from the reverse. So when I sit down with somebody and I'd say, what can we each do? What can each one of us do to stay safe? We can think about it like this. Are you washing your hands? Do you stay home when you're sick? Are you wearing your mask? So we use this conversation either way, depending on who that person is and where you want to get started. But it's also really important to think about all of the resources that really help us stay informed about COVID, stay informed about the best way to stay safe. And if you think about it, we use the STAR for doing that. The first way is are we communicating with that person the best way that they know how to learn, the best way that they, do they need it in plain language? Do they need videos? Do they need it in a different language? Do they need a friend or a family member to help them read it and understand that? The other way is who are the people in their lives that they trust? Helping them identify, is it a family? Is it a friend? Is it your doctor? Is it your case manager? Pointing out and helping that person identify those people that will help them make an informed choice. The other thing moving around the stars is where are you going to get your most up-to-date information? Are you going to the CDC? Are you going to the Department of Mental Health's website? Are you talking to your support coordinator and asking them for the most up-to-date information? But we also know you can go into the community. You can talk to your pharmacists, your schools, your senior centers, the things you do during your day, your dentists, your employers. That's a lot of other places we get our information. But we also know it's important to help people understand credible websites, credible news media, credible social media and blogs. So also trying to understand where maybe that information or misinformation might be coming from are also different strategies to support that conversation. But we also know if you want to stay up to date, check out most.covid.com for up-to-date information. You can also go to the Department of Mental Health Division of Developmental Disabilities website for a list of resources that would be helpful for you, or join them every Friday from 10:30 to 11:30 to find out what's happening currently. Or you can go to the Administration on Community Living's website for even more information about COVID-19. We hope this helps you think about how to stay safe and getting back to basics.
Anything else you want to add before we turn it over to Leslie?
I just wanted to let you guys know that we are here and available for you. You can Google us at Missouri Family to Family, and the Resource Center telephone number will pop up, and we're happy to visit with you and help to provide those resources that you might be looking for to gather your information and help in your decision making.
All right, thank you. Leslie, I think it's all up to you.
All right, great. Good afternoon, everybody. I'm Leslie, and I'm your Division Clinical Coordinator, and I'm going to review an informational toolkit that was created by the Division and UMKC and the Institute for Human Development personnel. This toolkit has credible information and resources about COVID-19 that you can use to make decisions about yourself, people you take care of, family members, anyone can use this information to help make those important personal decisions. This toolkit, I'm going to forward my screen here, go to the next slide. I'm not sure if you can see that. I might just share my screen. Is that okay? Because I'm going to also show some links.
Yeah, that'd be fine.
Oh, thank you. It kind of looks like that, and it's a 2-pager. I'll go ahead and pull mine up so you can see it. Blow that up for you. Thanks for your patience. Okay, this, if you'll just take a look at this, on the left-hand side, they have little symbols, and it kind of gives you an idea of what is in this section of the toolkit. This looks like a little person reading something, or maybe reading a newspaper, and it is supposed to represent general information. So this first link that we come to is from the Centers for Disease Control, or what we would usually just say CDC because it's easier. And it has easy to read COVID-19 materials that were made for people with intellectual and developmental disabilities and other people who want basic information. This second link is from the CDC also, and it's called COVID-19 Vaccines Are Important. It is also an easy to read, has easy to read information regarding the COVID-19 vaccines. And we'll look a little bit more at that here in just a little bit. This link will give general information about vaccines ranging from why they can be important and also who can get a vaccine. Now this next link I already pulled it up because I was worried my computer wouldn't pull it up right, but this is a really nice one. It was created by the Missouri Developmental Disabilities Council in partnership with the Missouri Department of Health and Senior Services. And we refer to it as the Missouri Plain Language Guide. And see this other long title here, it's a COVID-19 vaccine for individuals with intellectual and developmental disabilities, their families and caregivers in Missouri. And I just think that picture is so nice. It's such a cute picture. It highlights right here, choice is a powerful thing. Everyone has to make their own choice. And what we're doing here is just trying to provide those resources so that you guys can have the best information that we have out there. So here it says COVID-19 vaccine eligibility, anyone over 12. It also has a phone number for COVID hotline for Missouri. It also has the MostOps COVID website, which is just, they both have really good resources. It talks about what COVID is, like what is it even? How do you get COVID? What happens if you have it? It talks about the symptoms, so that's helpful to know. So you can, if you're feeling different, you can kind of compare. It talks about how sick you can get, and then how do you stay healthy? That's important because we want to, prevent as much as we can. And it talks about getting the vaccine, washing your hands, wear a face covering. Stay at least 6 feet or 2 arms length from other people that's not in your household. This is good too. Make a plan in case you have to stay at home. It kind of helps you think ahead of like, what are you going to do if you have to quarantine just in case. If you have a job, what if you're worried about missing work? It has some ideas there. It also has ideas, where can you go safely? How do you stay in touch with your friends? And then why is all of this important? What do you do if you're sick? What do you do if someone you live with gets sick? That's really important because it's hard to stay healthy when other people in your house are sick. And then if I'm sick, what do I do? When should I call my doctor? So that has all those good tips on there. And then again, it has the website for Most Stops COVID, and then the MoDD Council, their website as well, in case you want to look at that. So I'm going to pull up our toolkit again. And here we have two different things that the Division of Developmental Disabilities created. We have several, but these are pertinent to COVID. But they're called Observe, Decide, Acts. And what they are is informational sheets that we have posted on our website. One is strictly on COVID-19, and it has information about signs and symptoms, how to support individuals with disabilities, when should you wash your hands, like good hand washing, keeping your environment clean, social distancing, and then what do you do if you've been diagnosed, if you're having symptoms, or even if you're having anxiety or someone you care about is having anxiety about being sick and having to be quarantined, or just anxiety in general from this pandemic. It will take you to some resources that you can use to help get through that or help cope with it. Another Observe, Decide, Act that I want to show you, Lisa and I thought it talked and thought it would be helpful. This one is about pulse oximetry and COVID-19. You guys might not have heard about this before, and it's just a way to monitor if you're sick. It's a way to keep track and see if you're getting worse. And what you can do is use a pulse oximeter, and that's one of those things that's like a clothespin, and you clip it on your finger and it can read your oxygen levels and your pulse. And the document gives you information on what regular oxygen levels are, and it shouldn't be your main method of monitoring, but it's just a tool that can help you. So that way, like if their oxygen level goes lower, that might prompt you to seek medical assistance. And always refer to your doctor as well, because they may have parameters for someone you're taking care of or yourself that they might say, if it's such and such, give me a call. If it's this low, call 911, or they'll help you determine what would be best for you. And then if you're interested in getting a pulse oximeter or need help getting one, I recommend reaching out to your service coordinator for help with that. I was able to get one at a local store, so you can get them at places. Here it talks about what's a pulse oximeter, what to observe for, shortness of breath, breathing faster than usual. Maybe if someone feels sick to do their usual activities, like they're just too weak or too tired or just don't feel right at all. And then this is kind of wild too, because sometimes a person doesn't even have symptoms at all. They just seem regular, but then you go, they got COVID, they seem fine. You're going along about your day. Maybe you just do a check just to see how they're running, their oxygen's running, and it might be low, and you're just like, oh my gosh. So that could help prompt you to call the doctor. And this has a guide on how people's oxygen levels usually run. That's if you're not using oxygen, like see in that picture how the person's got oxygen in their nasal, in their nose, Well, if you don't have to use oxygen, then this is a guide on what it should run. And then if you use oxygen, it has a little information there about it. Because sometimes if you're having to wear oxygen, or if you have a lung disease, chronic lung disease, your oxygen levels may run a little lower. And then here we have other links to resources about utilizing the pulse oximeter. So just something that you guys, it's out there for you that you can use. And the link, like I said, is on this toolkit that you can definitely use and look at the information. Now over to the side here in the second section, you see that telephone, and that is to key you in that there's phone numbers on over here in this section. Missouri COVID-19 hotline and website, the information's there. It's information on how to access a vaccine near you or find information about transportation to a vaccine site. So you can visit their website here, mostopscovid.com, or call that number. So whichever you're more comfortable with. And then also CDC Dial. This is vaccine help for people with disabilities, and Dial DIAL, can help you find a location to get the COVID-19 vaccine, how to get there, and then any other questions you might have. And they also have an email address, which is handy because lots of people like doing email. And so there's their email address, and then they have a phone number here you can call. And then also, if you speak a different language, like if your main language is not English, you can call one of these numbers down here toll free, and someone can help you there. So that's a pretty good deal, being able to access information by phone and by email, and then by their websites. And let's see. Now this is pretty neat too. This represents like videos or book, like storyboards, or it's got a little music thing there. But it's stuff that you can look at and watch a video maybe to help you kind of figure out what it is that you're wanting to do. Now let's see here. I will show that link. And like I said, I already pulled them up. I was kind of nervous about my stuff coming up okay. Okay, so this is COVID-19 materials for people with intellectual and developmental disabilities and care providers. And so you can kind of go down here. I hope I'm not making you dizzy scrolling, but this is about getting a COVID-19 shot. And this is a neat little story. It's about Izzy, and I'll just open it up for you. There's Izzy, and that's her sister, and then that's the doctor. And so here, I'll scroll on down just to give you an idea. My doctor says I need to get a COVID-19 shot. The shot helps keep me from getting sick from COVID-19. And so you can see it goes through there step by step, what they do whenever Izzy's going to go get her shot. And it goes from start to finish, and it talks about follow-up, and it talks about maybe her arm sore, or she might have a little more symptoms from the shot than that. And so that's just a kind of a neat thing to be able to share with people. They also have posters, if that's anything that you'd be interested in, and that shows Izzy with her Band-Aid on and she got her shot. This one over here is an interactive fill in the blanks with multiple choice options, and that helps people get prepared. That can help people get prepared for getting a vaccine. And then over here to the right is a video, and it tells the story about Izzy getting her shot, and it's just more like a little movie instead of like a book. And the same goes with, they have them for washing your hands, only Izzy's not in all of them. They're different characters. Getting a COVID-19 test, that hopefully can help people not be anxious about that, because all this is, nerve-wracking for a person to have to deal with. How should I wear my mask? There's a story in a video, in a poster. Social distancing, that helps talk about that, because that is a difficult one, especially if you're used to being around people, and if you're, a lot of people, we need each other, so it's difficult. So this can help explain that and how to safely be around each other. And then over here is a caregiver tip sheet, and then right here is a provider tip sheet. So if you want to read more about these things in care, when you take care of people, you can definitely look at that stuff. Okay, I hope I'm not, hang on a second here. Okay. So CDC, stay safe from COVID-19. We looked at that. What to expect after getting a COVID-19 vaccine. This link will, it's a one-pager, and it tells, it's real easy language, and it tells, okay, what kind of symptoms might you have after you get your shot. Just different information as to how that goes about. And then here we have our symbol for person-centered planning. And this is the link to the UMKC IHD Back to Basics, a short video that highlights the importance of individualized support planning. And that's the one that we just saw, which is just a really good, just a great video. And then here we put in here also, if you go to that section, you can see that we have that link about materials for people with intellectual and developmental disabilities and care providers again, because it does have things in there for different people in making choices. Below that, we have the Missouri Department of Health and Senior Services. Find a vaccine location near you. And I will pull that up if we're not running out of too much time. Getting kind of close, but I can show you if that's okay. Because it's super helpful to know where to go. Hang on, I got a thing on my screen there we go. Okay, so this is the Department of Health and Senior Services vaccine, COVID vaccine mo.gov. And then right here, you can go to get a vaccine. And then you can, let's see, local vaccination events. And that, if you click on that, it'll show you, hang on a second, it's going slow. Oh, here we go. It'll show you events where you can go in and get, go get your vaccine. And if you go to, it shows different areas in different regions. Here, I'm gonna scroll back up so I can show you about the other one. Okay, let's see. So this is location for events. Or maybe I need to go to the bottom. Okay, here we go. So this is the federal vaccine finder. This might be an easier one in a way, and I'll tell you why. Because you can mark any of these 3 vaccines that you want that's COVID, Moderna, Pfizer, Johnson & Johnson's. And what I usually do is just hit all 3 of them. And I'll just tell you why, because they say the best vaccine is the one that you've gotten. So, but you may have other opinions on that, and that's just fine. But see, I'm going to put my zip code in here, 65340. And then and then I want to do it in, my opinion is 25-mile radius, but you can search even, up to 50 miles away. But I'm just going to put in 25 just because. And it shows, see, it's got all the places that have the vaccines. And if I hover over this, like Pilot Grove Rural Health Clinic, if you see over there on the map, it's got the phone number. So you can even call that place and say, hey, I'm interested. And then they can, you can find out what kind they have for sure. And see if you're able to just walk on in or if you need an appointment. So that, I feel like that's really a helpful thing. But there's also something else I want to show you. And I'll try to be brief about it, but it's important because you may not know this. Get a ride. If someone needs help getting a ride to get a vaccine, right here you can go down and there's different things you can click on to see about getting a ride to get your vaccine. So if you're having trouble with that, I'd encourage you looking that up. So just so you know, that's out there. And let's see here. Got a couple other things to cover. Department of, okay, the testing site. Yes. There's a site that talks about getting tested. Let's see. Okay, hang on a second here. I thought I had it already pulled up here. I'll pull it from here. All right, here's the Department of Health and Senior Services, and it'll tell about how to get free testing. And then here's some where they're having testing sites. That way, if you're having symptoms and you're concerned, you can just get a free test and there you go. And then also I want to point out to the right-hand side, there have hotspot advisories. So you can see if where your county is, if it's under a hotspot advisory, then hotspot means there's a lot of cases and there may not be a very high vaccine rate. And so it's just conditions are just to where you need to take precautions if you want to, stay COVID free and stay healthy. But it looks like yesterday, that was today, Bollinger and Madison counties, they were added to the advisory list, but you can always go back and look at that. And I'm going to show you something else on the right-hand side, that just real quick, monoclonal antibody treatment. That's an option if you just get diagnosed or start having symptoms. That is an option that if you meet the criteria, you or your loved one or whomever could possibly have this monoclonal antibody treatment to help decrease symptoms. But you would need to speak with your healthcare provider or even StationMD, which is an option that we have. And that is for all, let's see here, I'll tell you about StationMD real quick. It's a service you can use if you have a Medicaid waiver. You can look at information about it on this link right here. It's free for you. There's a physician on call and there are people who are trained to work with people with intellectual and developmental disabilities. They're available 24 hours a day, 7 days a week. They're not supposed to replace your doctor, but they can help, and they can confer with your doctor after, like, say that you're having a problem and you call or get a hold of them. They can consult with you and help you find the best path of how to get taken care of. And then they also communicate with your regular doctor to let to kind of, so that way everybody's in the loop of what's going on. But please visit that site if you want more information about StationMD. And like I said, it's free and it's for all waiver participants. And then the final section is a link to Charting the Life course from our colleagues at UMKC IHD. It is a variety of videos that can assist people while managing life with the existence of COVID. There are topics such as supporting mental health during COVID-19. I'll just show you just while I'm talking about it. I like looking at stuff. I already have it pulled up. Okay, so we have Charting the Life course for respite during COVID-19, tools for coping and planning during COVID-19, supporting mental health during COVID-19, and that's a big one. So all of you just remember that. Don't forget about your own mental health, the mental health of your loved ones during this troubling time. It's okay to get help. So in conclusion, that's the final thing on there. But in conclusion to the review of this kit, I want to emphasize that these materials are intended for informational purposes. They're credible resources. So, but I also want to add that we encourage you to consult your medical health provider for additional information related to your personal health care needs. And I just appreciate you letting me go over. I apologize about 6 minutes over, but I just appreciate the time being able to talk with you all about this. And I hope that what we're doing today is helpful for you. And I'm going to go ahead and turn it back over to Lisa. I'm going to stop sharing my screen. And I'll give Lisa there she is. There we go.
Thanks, Leslie. Thanks, Mary. Thanks for sharing all that good information. And just a reminder that if you are receiving services through the Division of DD or through one of the targeted case management entities, your support coordinator also has access to these materials and resources, and they can share them with you. Don't ever hesitate to reach out to your support coordinator. They've got lots of information, so they're a resource for you. And the one-page resource that Leslie just highlighted is on the division's COVID-19 webpage, and it's under the Individuals and Families Accordion. So it is out there. Go out, explore it, check on the links, and also, feel free to share this with other families and individuals that you know, because they can benefit from the information as well. And before we close today, I just want to invite everybody to reach out and get connected to the division's communication efforts. We send out email notifications on a regular basis. We share information about services, programs, and other different items related to DD. The division also has a Facebook page, a YouTube channel, and also be sure to check out our new newsletter called In the Loop. And this brings us to the end of our webinar today. Thank you all for joining us. We hope you find the information to be beneficial and helpful. And remember, as Kat mentioned at the beginning of the webinar, there's going to be a quick pop-up poll question or a survey question at the end. So please be sure and answer that for us, because it helps us to collect data on the webinars. Thank you all very much. Thanks for letting us go over and hanging in there with us.